Hi, everyone, and welcome to our Wound Care Micro Session series. I'm Sarah Holtman, Director of Clinical Education with Wound Care University. In these short sessions, about 10 minutes or less, we'll tackle one high impact topic at a time so you can take a practical pearl back to the bedside today. Our focus is simple: what to look for, what to do, and how to document it. Thank you for joining me. Today, Chelsea is going to discuss the fastest infection in medicine, a story featuring Alex Lewis.
The Fastest Infection in Medicine, featuring Alex Lewis. Imagine yourself feeling a bit under the weather, the kind of sluggish and achy day that feels like a cold or mild flu coming on. You've got a fever, some body aches, maybe a sore throat. You drink fluids, take Tylenol, and just expect that tomorrow you'll be back to normal. Instead, over the next few days, everything changes. And your story becomes one that reshapes not only your life, but also how healthcare providers think about the earliest signs of necrotizing infections. This is exactly what happened to Alex Lewis. What made this case so misleading is that it didn't start with anything alarming. No major wound, no dramatic injury that would expect. Just ordinary flu like symptoms that slowly morphed into something far more dangerous. For a while, it looked like he simply needed rest. But then came the pain, deep, intense, radiating through his shoulder and arm in a way that didn't match the fairly normal appearance on his skin. There was no cut, no bruising, nothing to explain why his arm suddenly felt like it was on fire. That disproportionate pain is one of the earliest, most important clues of necrotizing fasciitis. It's also the one that so often gets missed. By the time Alex reached the hospital, the bacteria had already begun moving through the fascia beneath his skin. His condition unraveled with terrifying speed. What started as a suspected cold escalated into septic shock. Next, his kidneys, cardiovascular system, and metabolic functions began struggling to keep up as the infection spread. This is the moment where necrotizing fasciitis reveals just how unforgiving it is. Patients can seem relatively stable until suddenly they're very much not. Alex's body was shutting down faster than expected, forcing the medical team to make life-saving decisions that came with enormous consequences. Multiple emergency surgeries were needed to stop the infection from overwhelming him completely. Surgeons removed large areas of necrotic tissue. Ultimately, his arms and legs were amputated. Portions of his face required removal and reconstruction as well. In the ICU, he hovered between life and death for weeks as his team fought to stabilize him. Alongside surgery and antibiotics, Alex received hyperbaric oxygen therapy, a treatment that played a powerful supporting role in his survival. HBOT doesn't replace surgery, but it changes the environment in ways the infection hates, flooding tissues with oxygen, slowing toxin production, helping immune cells regain their effectiveness, and improving the survival of marginal tissue that might otherwise be lost. In cases like Alex's, where perfusion was compromised and every bit of viable tissue mattered, HBOT became a critical tool in slowing the spread and supporting healing after the damage was done. If anything, Alex's case highlights how valuable early HBOT can be. Had treatment begun before such widespread necrosis, it might have preserved tissue, reduced the number of debridements, or shortened the period of organ failure. Too often, HBOT is introduced late instead of at the first signs of rapid, unexplained soft tissue deterioration. His story underscores why earlier suspicion, faster diagnosis, and rapid initiation of adjunctive therapies matter so deeply. Recovery for Alex didn't end when the infection did. His hardest work began afterward, in learning to navigate life as a quadruple amputee, undergoing reconstructive surgeries, training with prosthetics, and facing the psychological fallout of such a catastrophic illness. He regained independence, became a father again in the ways that mattered most to him, and used his experience to raise awareness about septic shock, necrotizing fasciitis, and resilience in the face of impossible odds. Alex's story isn't just one of survival, It's a testament to how fragile the line can be between a simple flu and a life threatening infection. It's a reminder for clinicians to listen harder to unexplained severe pain, to question symptoms that don't quite add up, and to consider early use of treatments like hyperbaric oxygen therapy before tissue loss becomes irreversible.
Thank you for attending this wound care micro session. We value your commitment to patient care. We'll be back with another focused topic soon. See you next time.